So our next segment brings two powerhouses together. We have Dr. Eric Chow. Dr. Chow is a fellow in adult infectious diseases at the Division of Allergy and Infectious Diseases, University of Washington. He received training from the CDC Epidemic Intelligence Services and was part of the team that responded to the very first COVID outbreak in the US, right here in Seattle. And we also have Dr. Janna. She's a professor in the Department of Physical Medicine and Rehab at UW Medicine. She is the vice chair for clinical affairs at the Department of Rehabilitation Medicine and executive director at the UW Medicine Post-COVID Rehabilitation and Recovery Clinic. And Dr. Friedli founded the Post-COVID Clinic at UW to address the exponentially growing number of long COVID cases in the community and strives to provide multidisciplinary innovative care to this population. So thank you so much, Dr. Friedli and Dr. Chow, for joining us today.
Thanks for having us.
Yeah, very excited to be here.
Thank you. So we will start with Dr. Chow. Dr. Chow, you literally saw the pandemic unfold as a scientist physician. Could you please tell us what role epidemiologists play during outbreaks?
Yeah, sure. Yeah, excellent question. I think that there are so many different roles that epidemiologists play. And I think that in order to understand what they do during outbreaks would require us to kind of dive into what they do during non-outbreak times too. So I'm glad that the term epidemiologist has become kind of like a common word within households. I know a lot more people are using it. I think before the pandemic, I kind of had to explain to people what an epidemiologist did. But as all of you are aware, epidemiologists do a lot of different types of work. In general, these are individuals who work in public health. They investigate infectious and non-infectious diseases. They study patterns of disease and they try to understand how they affect individuals and communities. They collect data, they analyze data, and then, as you heard earlier, they're in charge of messaging this data to be able to put them into succinct key messages to clinicians, policymakers, and the general public. They're skilled individuals coming from a variety of different backgrounds. They can have all levels of education up to doctoral level training. Physicians, nurses, physician assistants, pharmacists, doctoral researchers, laboratory researchers, veterinarians, lawyers, and many more. So there's a lot of things that epidemiologists can do depending on the research, depending on their training background. And they can work for a variety of different levels of government, non-governmental organizations, hospitals, universities, pharmaceutical companies, you name it. And that's, of course, not an exhaustive list. And even within a specific setting, an epidemiologist can have a lot of different types of roles, and different epidemiologists could also do different things like study design, data management, field work, modeling, public health messaging, policy development, leadership. So there's a lot that they can do. So that speaks to kind of the plethora of roles that they might fill. So one of the important things that I would say that epidemiologists do is setting up and managing disease surveillance systems. And this helps them track diseases in the community, helping them to understand what is normal, what is the normal number of infections that you would expect in a particular population. The same surveillance system then helps them detect abnormal number of cases. And so this might indicate an outbreak. And because epidemiologists are involved with disease investigations to understand what these abnormal numbers are, they're frequently referred to as disease detectives. And so during an outbreak, epidemiologists step up to try to understand what is going on, why this outbreak is occurring, how it started, and then they advise on how to prevent the outbreak from getting worse. And I think probably one of the most important aspects of being an epidemiologist during an outbreak is about what happens after the outbreak is over. How do they inform policy? How do you use the data you collected to help prevent such an outbreak from happening again? And I do want to, answer this question by using SARS-CoV-2, or the virus that causes COVID-19, as an example. This is a novel infection among humans and really never before seen in people. It became a small local outbreak, but early data on the infection was sparse, and the infection spread much faster than collected data could really provide guidance. And as a result, the outbreak grew, covered enough ground, reached enough people, and unfortunately affected enough countries that the WHO, or the World Health Organization, declared it a pandemic. But epidemiologists were essential to all stages of the pandemic, including their work on uncovering SARS-CoV-2 as a causative agent of COVID-19, determining the origins of the virus, understanding how the virus is transmitted from person to person, discovering community transmission with here in the US through surveillance systems, and assessing risk factors for severe disease burden, and even assessing how well the vaccines work within the community. A lot of epidemiologists also work on modeling or trying to understand how the virus spreads within the community, and determine, using this data, they'd be able to determine when we might expect new variants or the next surge. As you heard earlier, messaging is really important within public health and what the work that epidemiologists do. So messaging public health recommendations has been really important within the epidemiologist's role as well. And then, as you'll hear, studying long COVID is also a really important aspect of what epidemiologists do currently. Of course, an ongoing effort that's not fully understood.
Thank you, Dr. Chow. So the next question is for Dr. Friedli. So Dr. Friedli, you specialize in rehab medicine, treating people with disabling conditions, and we now see long COVID emerge as a debilitating condition too. So please tell us a little bit about what this entity is and how significantly are people impacted by this condition?
Yeah, absolutely. So as Dr. Chow just mentioned, long COVID is becoming a bigger and bigger issue that we need to focus on and study. And so just as for brief background, my specialty is physical medicine and rehabilitation that really here in the United States got started and blossomed really during the polio epidemic, and taking care of people with post-polio conditions and rehabilitating them. So it's very natural that people in physical medicine and rehabilitation sort of step in to help on the recovery side from a variety of illnesses and viral illnesses like COVID. And so initially when we got started in working with people recovering from COVID, we were focused on people who were in the hospital. So people who were in the hospital for a long period of time in the ICUs and had very debilitating sequelae from COVID. And that was initially our focus. And then we very quickly realized, and around the world realized, that even people who were getting mild infections, people who may not have symptoms at all at their initial infection with COVID, were starting to develop some of these longer lasting symptoms. So they sort of coined the term long COVID to describe the condition that people were having, where they were having symptoms, 2 to 3 months after their initial COVID infection, regardless of how severe the initial infection was. And there's lots of different definitions of long COVID. The World Health Organization has sort of landed on a post-COVID condition, meaning that you have symptoms 3 months or longer after your initial COVID infection. And those symptoms last for about 2 months at least. That's generally the definition that we're using, and the symptoms that people are experiencing are many. So there's been reported over 200 different symptoms that people are experiencing after COVID that are part of long COVID. Most commonly, people are experiencing fatigue and post-exertional malaise. So feeling muscle aches or fatigue after exertion or exercise. People are having a lot of brain fog and cognitive symptoms. And then there's a lot of psychological sequelae as well, with anxiety and depressive symptoms. So it's a little bit hard to define because there are so many symptoms that people experience with long COVID. But in general, it's that you've had COVID of any severity, and that you have persisting symptoms after COVID that you didn't have before, or that are worsened from before you had COVID. And when you think about the scale of how many people have had COVID around the world, it's an incredible problem, because we're recognizing that probably about 10 to 30% of people that have had a COVID infection, regardless of the severity, are experiencing long COVID symptoms. So some of the epidemiology work is to try to understand how many people are affected with long COVID, and I think we're still trying to to work that out. But the estimates here in the United States are that now there's at least 25 million Americans that are affected by long COVID, and that may be an underestimate, just depending on how you define long COVID. So it's an incredible issue with just a huge magnitude of people affected.
Thank you for that, Dr. Friedli. So the next question, Dr. Chow, would it be fair to call COVID an endemic now? And where are we with regards to COVID-19?
Yeah, great question. I really appreciate this, mostly because I think that the term is used a lot, particularly news articles and the lay press. But I'm not sure people fully understand what endemicity actually means. So maybe we can start off with a little bit of a review. Endemicity actually generally refers to something that belongs to or is native to a particular area. So for example, I often use the example of kangaroos. Kangaroos are endemic to Australia, meaning that they live there naturally, and similarly, pine trees are endemic to the Pacific Northwest. However, truthfully, there's no agreed upon definition for endemicity with regards to viruses and infectious disease. And I think different people are applying different criteria depending on what their objective is. And but in general, infections such as influenza is sometimes referred to as being endemic within a particular population where there's some degree of predictability in its circulation. And influenza circulates regularly between people with fairly predictable seasonal epidemics occurring in the winter and temperate climate zones. But every year, I think one of the things to keep in mind is that every year, influenza still causes hospitalizations and death in people of all ages. So endemicity does not suggest anything about the severity of the disease. So let's take, so going back to SARS-CoV-2, again, the virus that causes COVID-19, I think there's a lot of discussion about that transition point from when we go from COVID-19 pandemic towards an endemic status. And I think that sometimes focusing on or looking towards endemicity as the end of the pandemic may make us lose sight of what kind of is important here, the public health messaging. It by no means suggests anything about the severity of the disease or the impacts on the people who get an infection. So let's start off by summarizing where we are right now with regards to COVID-19. So as many of you are aware, many people have now developed immunity either through infection or vaccinations, and then with vaccines now available to one of the youngest age cohorts down through 6 months of age. But we're also realizing that reinfections are common and new variants are emerging, suggesting to me that SARS-CoV-2 will likely continue to be a common infection in the community. So here are some key points that I think are important takeaways here. So new variants are causing surges without a predictable burden. We are still trying to understand SARS-CoV-2 reinfections and the risks of severe disease in these settings. The seasonality of SARS-CoV-2 hasn't really been fully established, whether we should see peaks of cases every year during particular seasons, or whether we would see year-round circulation is not clear. And although there are fewer deaths currently than at other phases during the COVID-19 pandemic, an endemic virus is not contingent upon a more mild virus. People would still be at risk for feeling poorly when infected, at risk for severe disease and death, and at risk for post-COVID conditions or long COVID. So I would say in summary, there are a lot of indications to me that SARS-CoV-2 is here to stay, but its predictability, I think, is a big thing in terms of surges and burden of disease hasn't really been established. So severe disease and long-term outcomes are still concerns regardless of its endemicity status.
Thank you, Dr. Chow. So, Dr. Friedli, you were instrumental in developing the post-COVID clinic at Harborview Medical Center. Can you please talk about the interdisciplinary functioning of the center and how are different fields of medicine coming together to address this crisis?
Yeah, so I started this clinic with just 2 other rehab physicians back in about April of 2020, so very early in the pandemic. And again, we like I mentioned earlier, we were really focused at that time on the people with severe COVID that were recovering, who went to into the hospital and the ICUs and may have needed to go to acute inpatient rehab as part of their recovery. And so we set up this telemedicine clinic for people that were recovering from COVID. And then we quickly realized that there was this whole population of people that weren't hospitalized, that had the mild to moderate infections. And we're really having a lot of the long COVID symptoms. And at that time, we also recognized that the symptoms of long COVID are so complicated. There's so many different symptoms that people are experiencing. They're experiencing, fatigue and brain fog, cognitive issues, psychological issues. They're experiencing tachycardia or fast heartbeat and changes in their blood pressure and heart rate. So it was really clear that because it was so complicated and there were so many different symptoms that people were experiencing, that it really would take a team approach to helping to manage these patients. And so we at UW brought in primary care physicians, internal medicine, family medicine. We work closely with the neurologists and many of the other subspecialties that are taking care of patients to try to coordinate care. So we have definitely a team approach to really try to sort of coordinate all the care that people need and make sure that we're taking care of people holistically. And so this was really, I think, critical in providing that comprehensive care for people. And it really was an opportunity to bring together a lot of specialists that oftentimes work in silos. And we just recognize with these patients, you can't do that and really adequately manage the symptoms that people are experiencing. And I'll just say, I want to just comment on something that Dr. Chow, talked about, some of this unpredictability of the outcomes of COVID. And I'll just say that we at UW are continuing to see huge increases in the number of people that are having these symptoms. So even people now who have been vaccinated, who are getting COVID, are experiencing some longer term symptoms. So I think that's important to consider as we go forward with COVID, that long COVID is really a long-term public health issue that's not going to be going away anytime soon. So we need to continue to figure out ways to work together to help manage it.
Thank you, Dr. Friedley. So Dr. Chow, we're hearing about so many variants with COVID-19, B12, B4, B5. So do you think variants and surges will be the norm?
Yeah, one of the key takeaway points here, I think it's a recurring theme, is that SARS-CoV-2 really throws curveballs, and there's so much yet that we don't understand about SARS-CoV-2, including kind of variants. But just a quick review on virology. SARS-CoV-2, as some of you are aware, is an RNA virus. So it's very prone to creating mistakes every time it replicates. So every time it has an opportunity to replicate, it has an increased chance of creating new mutations. Some of those mutations work, some of those don't. And then the ones that are more fit, the ones that are more contagious, the one that's able to transfer from one person to the next, are the ones that will survive as these variants or variants of concern. And so I think that, yes, in general, SARS-CoV-2 will continue to create these new variants. They will emerge and then cause surges depending on the population's level of immunity and then public health precautions that individuals take or maybe they don't take. So all those will play as factors. I think the other thing that's important to kind of recognize here is that, the term variants this is probably one of the first times where kind of the general population is using this term, mostly because of our advancements in science and medicine. There's been a lot of advancements during the pandemic, and this has included our ability to be able to study viruses on a genomics level that we really didn't previously have on a routine basis. Genomic sequencing, rapid molecular testing have expanded our knowledge, and not just for SARS-CoV-2, but other respiratory viruses as well. And has actually enhanced our ability to understand epidemiology and the connections between individual viruses and humans that they infect. It has also allowed us to apply this genetic data at the population level. So many of you may have heard of Dr. Trevor Bedford, who's a fantastic genomics expert, and he has contributed a lot of data and has advanced our field. Anyways, all of that now, because of that technology, we're able to detect a lot of these new variant surges as they emerge onto the scene, especially as genomic data is quickly kind of shared across collaborative partnerships around the globe. And so, with Omicron, we heard about this from partners in South Africa who had used this technology to be able to alert the rest of us as it was emerging there. So we were able to predict and hear about it and kind of prepare for it to a certain degree. I'm also hopeful that this type of technology and the continued advancements will also be able to help us potentially forecast or model or maybe even predict what might be coming next. All things that people and experts in the field are continuing to work on. So I very much look forward to seeing where these advancements will take us.
Thank you, Dr. Chow. So, Dr. Friedli, since long COVID is such a new and emerging condition, how are physicians and scientists like yourself developing techniques to treat these patients, and what kind of innovations are you using?
Yeah, so I think there's a few things that I think are important to recognize. One is that we currently know a lot less than we believe about how to best treat long COVID. So there is a lot of ongoing research on a variety of different treatment approaches, but currently there is not one single treatment for long COVID, and I think we're still even really learning about what the pathophysiology is and what the underlying immune system response is that is driving some of these symptoms. And it probably is that there's multiple different immune system responses and other phenomenon that are going on because there are so many different symptoms that people are experiencing. So with that in mind, as we think about treatment, there isn't one single treatment that we use, and we really have to approach it individually for each individual patient, look at the symptoms that they're experiencing, their comorbid conditions, all of the different factors that play into how they're experiencing the symptoms of long COVID and develop treatment strategies for those for that individual person. So I think that's important to recognize that there really, at this point in time, is not a single treatment. And I think over the next 6 months to a year, if you have this talk again, there will be more treatments that have been studied in clinical trials. So I think in terms of the sort of innovations that we've seen, I think there's been a few. One is that we have very quickly had to develop clinical trials, and there are a lot of networks and infrastructure that's being built to be able to rapidly conduct observational studies as well as clinical trials and trying to understand what the pathophysiology is and the risk factors and trajectory of recovery, as well as different treatment options. So here, the NIH and CDC are funding a number of large studies that are really trying to get at these things that are ongoing. I think from a clinical standpoint, the other sort of innovative, and it may not seem that innovative, but to us it was at the time, was really using telemedicine. So I think in healthcare here in the United States, some people were using telemedicine a little bit, but really the pandemic sort of forced us to deliver a wide variety of medical care using telemedicine. And that was certainly what we did in our long COVID clinic. And that really was innovative in the sense that it allowed us to have a much broader reach for seeing patients. We were able to see patients in rural parts of Washington state. We were able to see patients in very rural and remote areas of Alaska, as well as Montana and some of the other neighboring states. And so that did allow us to improve access to care for patients. So I think that was innovative. And then, the other, just in terms of treatment approaches, we have adapted a lot of our treatment approaches from other conditions that may have overlapping symptoms. So people who experience chronic fatigue syndrome from other viral illnesses and other kinds of autoimmune conditions that have fatigue and cognitive dysfunction. So we really adapted a lot of our treatment strategies from things that we knew from other conditions were effective, and that there is efficacy data for those. But really, when you're thinking about long COVID at the moment, most of it goes back to the fundamentals of good health, and that's improving sleep and improving diet, exercise, strengthening your immune system, and really learning how to self-manage symptoms. And so that's a lot of what we do, which is not innovative in terms of new treatments, but is innovative in that that's often not the focus of what we do in medicine, but incredibly important.
Thank you, Dr. Friedli. So, Dr. Chow, could you please talk a little bit about how we can build COVID resilience as a community and globally?
Yeah, what a great and challenging question. I think that this can probably be a presentation in and of itself. But I think there are many different ways to approach this. And I think that there are two particular areas that I would like to focus on today about building a resiliency. One of them is from the individual standpoint and shifting our mindsets. And then also one at the community level. So I generally try to tell people that it's probably important now to acknowledge that we can never really undo the COVID-19 pandemic, and that we should really think about our lives in the context of this new normalcy. I think those who remain hopeful that one day we could return to that pre-pandemic era or bliss will certainly leave people exhausted, because you'll be forever waiting. And I think that I don't need to say this again, but I will. But COVID-19 has really fundamentally changed our assessments of risk when we're doing our daily activities, from the perspectives of getting the infection, severe disease, death, mortality, all those things, but also long COVID. So even if we don't die from the disease, there's still a lot of complications that should factor into our everyday assessment of risk. We probably previously didn't think about doing activities with an assessment of risk, but that has become kind of a new reality and an important one if we're trying to make sure that we are able to still enjoy the activities that we want to do. All that being said, I think the good thing is that public health messaging has really equipped all of us with the knowledge of how to do activities safely. So like many of you, I started wearing a mask during the pandemic, which may now be an important part of the clothes I wear to go out to do activities, when I socialize with people, when I'm doing errands, or when I'm not able to safely predict when social distancing can be achieved in particular scenarios. So another good example is that, I really enjoyed experiencing new restaurants before the pandemic. I used to like to eat out a lot. That was a really important activity for me. But considering the risk of transmission, particularly in those types of indoor settings, the pandemic has really changed the way I approach dining. So I try to slowly integrate that, keeping in mind local circulation, things like that. But in general, if I do end up eating out at a restaurant, I try to dine outdoors. I try to go to places where tables are set apart from one another. I try to beat the rush, eat early. I try not to eat at restaurants on weekends. So I think with careful consideration of these factors, we can begin to integrate some of these activities that are important to us. And when we're trying to get through the stresses of the day, particularly the ones that are caused by COVID-19. And I think that we can do this safely and thoughtfully, despite the changes because of the pandemic. The other thing that I think is important to kind of point out is really from the standpoint of community. And so community resiliency and social equity is so important. I know this is probably alluded to at various other presentations throughout the day, but the pandemic has really laid bare stark differences in resources accessible to different communities of people, leading to some families being disproportionately impacted by the pandemic. Individuals who have fewer financial resources are also those who don't always have access to regular medical care and amenities that allow them to be able to wade through the pandemic. Many of these communities may also experience systemic injustices that make facing COVID-19 pandemic that much more difficult. And I think really to be able to improve resiliency, locally, within our country and globally, we really have to make a concerted effort as a society to address policies that perpetuate inequities. So those would be like two big areas that I think is really important. But of course, there are many, many other things that go into COVID-19 resiliency.
Thank you, Dr. Chow. The next question is for Dr. Friedli. So Dr. Friedli, in terms of preparedness for the future and dealing with sequelae of pandemics, what is your advice for health systems and healthcare organizations?
Yeah, so this is another equally challenging and broad topic that I could talk all day about, and some of what I want to say I think overlaps a lot with what Dr. Chow just talked about. But I think for me there's been a few key lessons from this, and I think one is that this has really given us, and especially thinking about our care of long COVID in particular, it's given us a roadmap for how to provide coordinated and interdisciplinary care, and really, as we talked about, bringing together many different specialties to care for people, especially with complex problems, rather than working in these sort of highly specialized silos that we have gotten used to doing. And so I think going forward, that is going to be incredibly important for healthcare organizations to incorporate more of that type of care. And I think ultimately that will really be more value-based care, really caring for populations of patients and really thinking about team approaches rather than siloed care. I think that the second thing is similar to what Dr. Chow has mentioned, that we've learned that our healthcare system needs to continue to innovate to better care for people who are vulnerable and those marginalized populations, and this pandemic in general has really shown an incredibly bright spotlight on health disparities. So we know that people of color, people with disabilities and chronic conditions, older adults, have all been particularly hard hit by the pandemic, not just directly by COVID, but as Dr. Chow alluded to, in so many other ways. So not just the developing severe COVID or complications from COVID or death, but also, they've been hard hit financially due to the economics of the pandemic, hard hit psychologically due to isolation, and many other things. So we need to innovate our healthcare systems to better protect these populations and reduce disparities and access to care and how we deliver care, which I think is going to be critical, going forward in the next pandemic and even now. And then the third thing I think is, for me, is relates back to climate change. And I know you've talked a lot about climate change, but with the changes in climate, we all become more vulnerable, not only to catastrophic climate events, but also to pandemics and broader effects on health. And so we have to link climate change to pandemics and to health consequences. And again, I don't think that we've done enough to protect people who are the most vulnerable to the effects of climate change on health. And we have definitely not trained our healthcare workers to understand how to protect and help people with disabilities and chronic conditions become more resilient to the effects of climate change, and to better prepare them for catastrophic climate events and pandemics. And there's lots of different examples of this. From my perspective as a rehab physician, one that always comes to mind to me is working with people with spinal cord injuries. So you have a person with tetraplegia who is paralyzed from the neck down, who may need a power wheelchair and ventilator and physical assistance from other people in order to survive. And these people are particularly vulnerable to catastrophic events that may require them to be evacuated from their homes. They may lose power or access to the equipment or physical assistance that they need. But they're also more vulnerable to things like respiratory illnesses like COVID or the potential effects of COVID or to poor air quality. And in addition, they have added to that may have reduced access to vaccines and other effective treatments for prevention. So I think that's just one example, but there's many different examples. And we need to teach our medical students and our healthcare workers, all of our students, to help patients prepare and sort of think about these issues proactively. And as a healthcare system, I think we need to invest more in education about the relationship between climate change and health, and really developing strategies to protect vulnerable populations.
Thank you, Dr. Friedley. So the next question we have is for Dr. Chow. So as an infectious disease physician and epidemiologist, what is your advice on what lessons we should learn from the COVID pandemic and how we can apply them to future infections?
Oh, so many lessons. All right, let's see if I can do this justice. I'm going to hit some highlights. There's certainly not a comprehensive list, but I think there are some good take-home points here. Especially since we're likely to experience large-scale epidemics and pandemics in the future caused by infectious diseases. So, one, I think what's really important is that we need to invest in public health infrastructure and improvement to the healthcare system. And having this prepared for the next pandemic is critical. And that includes making sure that we have a good sustainable workforce and ensuring that public health organizations are no longer underfunded and healthcare systems have the resources to be able to address kind of the pressing issues, even in non-pandemic times. The pandemic has laid bare kind of the challenges that we still face, even outside of these outbreak scenarios. So making sure that we empower public health officials and healthcare systems to be able to support and provide the care that the population needs is really essential. And this also includes supporting public health and healthcare burnout. Because if without the workforce in place, we might not have the necessary support from when our community needs them the most. And I think that is a huge issue that still has not been adequately addressed. And so the other area that I think is really important that I actually heard mentioned in the last presentation is that the general public, I think, is becoming more and more or better acquainted with the scientific process. Scientists in medicine are ever changing, and we go through this process, right? We collect additional data, we interpret the data, and we come up with new theories, new ideas, new recommendations. And I think that for the first time, people are realizing how we think, but they also don't fully understand how we think, because they see these updating recommendations as kind of being wishy-washy and constantly changing and being annoyed by that. But that's the reality of science, right? We get new data and we update our recommendations to provide better recommendations. So I think that it is important for us to take away that, as we integrate science more into our messaging, we also have to be flexible as a society and be willing to be, roll with these changes. The other thing that I think is really important, particularly in my line of work, is understanding how non-pharmaceutical interventions or the interventions that don't include vaccines or treatments really helped us reduce transmission, because it's likely that the next large-scale epidemic or a pandemic is a respiratory virus. So what we learned is that things like masking, social distancing really played a role in helping us to decrease the number of infections transmitted not just by SARS-CoV-2, but other respiratory viruses. But they work best when used by everyone. And so when we do kind of a piecemeal effort, it's just not as effective, but they still work at the individual level. I think the other thing that's an important takeaway, particularly as we think about transitioning back to in-person work or opening up businesses again, is a focus on air quality. And again, this in part, this is about helping businesses and organizations improve the spaces, enclosed spaces, to help mitigate transmissions as people come back and are not able to socially distance. So air quality, I think, is really important. And I think lastly, again, it goes back to social inequities. I think that so many of these things have been highlighted and accentuated by the COVID-19 pandemic. These existed before the pandemic emerged and has been exacerbated by its spread. And we need really deliberate and concerted efforts to dismantle both systemic racism and the marginalization of minority communities. And this must take place across all aspects of society and all levels of government. The term decolonization has been commonly used, and I think it's very fitting because decolonization of societal policies that perpetuate injustices will require a lot of training, studying, and collection of data, and then implementation across all organizations. So there's a lot of work to do, and I'm excited that so many of you are interested in this field. There's, regardless of what your interests are, I think that there are just so many niches to fill, and I look forward to kind of creative ideas on how we can tackle these future challenges.
Thank you, Dr. Chow. So before we take questions from the audience, can you please talk a little bit about monkeypox? I know that with the recent outbreak, I know the community has a lot of questions, and it would be great if you could give a brief overview of this outbreak.
Sure. You're referring to me? Yeah. Yeah, so yeah, definitely. So first of all, I think that there's still a lot to learn about monkeypox. I think that in summary, there's an increase in the number of cases of monkeypox that we've noticed over the last few weeks to months. But again, I think going back to a statement that I mentioned earlier about the genomics, we're using genomics to compare monkeypox cases against one another and dating back to several years ago. And it's increasingly apparent that monkeypox may have been circulating in the community for some time, and it's evolving, although at a different rate than, say, SARS-CoV-2, because monkeypox is caused by a DNA virus, which has it still mutates, but maybe at a slower degree. So it's been happening for some time. Again, there's a lot that we still haven't understood, and it seems to be affecting certain populations. So there's a lot for us to understand to be able to provide the ideal guidance. I think the other thing that we should kind of keep in mind is that monkeypox, two things. First of all, the name monkeypox I think is a little bit of a misnomer. Monkeypox does not originate from monkeys. It was first discovered in monkeys, but it's thought that the population that causes it is, or the reservoir is actually rodents in Africa. And so, we're still trying to understand how that jump was made and how this has continued in the populations. I think the other thing is that it's important, not just specific to monkeypox, but just infectious diseases in general. There's a lot of things that we're still trying to understand, and empowering public health to be able to look for and detect these types of infections that may be secretly kind of traveling through populations is really important. And the only way we can do that is to build additional surveillance systems and to be able to provide the necessary resources so that people can actually study it. So I think that's where we're at.
Thank you for that overview, Dr. Chow. This was very informative. This was a very incredible conversation and so informative and enlightening. So we'll now take a few questions from the audience.
So I have one question from the audience. And so people were asking if you believe that the US should have policies that increase the level of intervention regarding vaccination to prevent a wide range of diseases as well as future pandemics.
Meaning like mandatory vaccine policies?
I'm not entirely sure from the question
okay.
that was asked, but that is what I think the essence.
Yeah, no worries. I think the answer to this question actually goes back to kind of a lot of the themes that have come up. I think one of these things is improving our messaging. I think it's so key to be able to reach families and to meet families where they're at, to be able to understand their concerns, their fears, their thoughts about vaccinations, and about ensuring that they have the proper information to make the best decision for their family. I think it's also I really like this recommendation from the previous speaker about approaching people with empathy, because we don't fully understand all their concerns. We don't fully understand the the knowledge that they've been given. But oftentimes the people that I've been able to change minds about receiving a vaccination comes about when you sit there and you listen to their thought process. And then you sit with them and you work through kind of their concerns and meeting them where they're at. I think the issue that comes into play where people really get turned off by vaccine messaging is that when they feel like they're being lectured to, and that they feel that your view is the only view that people have. And I don't necessarily think that that's correct. And I think that using a homogenous kind of messaging approach, I think this is where we fail. We really have to do a personalized approach, as Dr. Freely had spoken about with regards to long COVID. The same applies to vaccines. I think the other thing to improve vaccine uptake is really trying to make sure that people have access to vaccines, right? There are going to be people who are already up to date and they know that the vaccines for, say, like youngest children is coming out this week, but there are a lot of other people who are just not following the news and just don't know that it's now available. So how do you reach that group of people who are not routinely checking the news for when the FDA is going to approve the next vaccine? So making sure that we have people who are going to be our community outreach individuals is so key. And that should be integrated, not just within public health, but within medicine, all levels of government. We're missing people. And I think that is an area where we can really improve on.
I have another audience question here. Folks were talking about, we all know the information regarding COVID-19 and vaccines. And you alluded to it a little bit in terms of communicating about vaccines, but folks were wondering for future diseases like monkeypox, how can we mitigate the spread of false information?
Yeah, again, this is an area that I think we're all learning. I think that previously, I think we focus on, scientists communicating exactly the data that they studied the issue, they summarize the issue, and then they communicate it as if they're talking to another scientific colleague. But I think that communicating data at a level that is understandable and interpretable to a wide variety of audiences really does require a very specific skill set. So not only do you need to train scientists to be able to do that, but also you need communicators, people who work in the media, who are savvy, who understand their audience and be able to then make sure that they deliver that information in a digestible way. And then also you need people who are able to understand social media and, how to reach particularly the younger people. Because I think that oftentimes, if you have like an age gap and a technology gap and people don't understand how, say, like Twitter works, then you have a missed opportunity of making sure that you have, you get the right information out there. I think part of the issue about messaging, particularly say like with new infections, or newly recognized infections such as monkeypox, I think that making sure that you have a team ready, that you have like preemptive information that can help stem the wave of misinformation ahead of time. And then that also requires you to have community partnerships, right? Having built trust within certain communities, I think is also really important here to make sure that you get ahead of misinformation.
So I have one more question is for Dr. Friendly about how solving the problem, like how can we go about solving the problem of long-term COVID, like rehabilitation targeted towards the patients?
Yeah, so I think it's a complex problem, so it's going to take a multi-pronged approach, and I think starting upstream, the best way to prevent to deal with long COVID is to prevent it. And so that goes back to continuing to try to reduce the number of COVID infections overall. So still the same messages, that Dr. Chow talked about in terms of vaccines, as well as all of the strategies on an ongoing basis to reduce the incidence of COVID are going to be incredibly important, because we still don't understand exactly who is at highest risk of developing long COVID symptoms. And we do know that people who have more severe COVID infections initially have more longer term symptoms and sequelae. So certainly anything that we can do to reduce the initial severity, the incidence and the severity of the initial infection, I think is incredibly important. And then I think, because there are so many people that are already affected with long COVID, it's going to take a lot of resources really directed, at the primary care level to be able to manage the symptoms of long COVID until we are able to identify a specific treatment that really gets at the core of what's causing long COVID in the first place. So I think it's going to take a multi-pronged approach. We know here in the United States, there's starting to become more attention to this issue and more national resources. So the White House and administration has put forth a national plan for dealing with long COVID, which I think is a step in the right direction. They're starting to invest in more research in long COVID. So building some of that infrastructure that I talked about for research through the Recover study, Inspire study, and other networks. And then they are also putting forth resources to really building out these multidisciplinary long COVID clinics throughout the country and expanding resources for primary care and sort of educating all healthcare providers about how to best manage long COVID. So I definitely think it's going to take many different approaches. And really, as I said, sort of shifting our mindset from thinking that this was something that's going to resolve quickly to developing a comprehensive long-term public health strategy for managing long COVID, I think is going to be what's going to be most effective.
Thank you so much, Dr. Friedli and Dr. Chow. We really appreciate you joining us and giving us time today.
Thanks for having us. And it's inspiring to see so many of you here. And I'll just echo what everyone else has said. We really look to you to build the future in terms of healthcare and dealing and tackling all of these really challenging and important issues. So I'm inspired by all of you.
Thank
Absolutely.
you.
Yeah, thank you
Thank
so
you
much
so
for
much.
having us.